Cyclobenzaprine, also known as Flexeril, is one of the most commonly prescribed muscle relaxants. But is it safe for you? In this video, we'll break down how it works, the most important side effects to watch for, and key safety tips you need to know before taking it. Cyclobenzaprine, Flexeril uses, side effects, and important safety information. What is cyclobenzaprine? Cyclobenzaprine, commonly known by the brand name Flexeril, is a prescription muscle relaxant. It is often prescribed alongside rest and physical therapy to help relieve muscle pain and discomfort caused by acute musculoskeletal conditions. Cyclobenzaprine is available in two forms: an immediate-release tablet and an extended-release capsule. Unlike some other muscle relaxants, it is not classified as a controlled substance. Because cyclobenzaprine can cause drowsiness, it is important to avoid alcohol while taking this medication. Combining the two can increase the risk of dangerous side effects. What is cyclobenzaprine used for? Cyclobenzaprine, Flexeril, is primarily prescribed to treat short-term muscle pain, muscle spasms, stiffness or discomfort caused by acute conditions. It is not typically intended for long-term use and is usually prescribed for a duration of 2 to 3 weeks. How does cyclobenzaprine work? Cyclobenzaprine acts on the central nervous system, specifically the brain, to help reduce muscle spasms. By calming overactive nerve signals, it can ease pain, tenderness, and stiffness associated with musculoskeletal injuries or strains. What are the side effects of cyclobenzaprine? Like many medications, cyclobenzaprine can cause side effects. Some are more common and tend to improve as the body adjusts, while others may be more serious and require medical attention. Common side effects: immediate-release tablets. Drowsiness, up to 39%. Dry mouth, up to 32%. Dizziness, up to 11%. Fatigue, up to 6%. Headache, up to 5%. Common side effects: extended-release capsules. Dry mouth, 6 to 14%. Dizziness, 3 to 6%. Indigestion, up to 4%. Nausea, 3%. Fatigue, 3%. Constipation, 1 to 3%. Drowsiness, 1 to 2%. Other possible side effects include blurry vision, irritability, confusion, nervousness, weakness, diarrhea. Serious side effects: seek medical attention immediately if you experience any of the following: severe allergic reaction, hives, difficulty breathing, swelling of the face, lips, tongue, or throat. Serotonin syndrome. Symptoms include rapid heart rate, fever, sweating, shakiness, muscle stiffness or twitching, confusion, hallucinations, or even coma. Seizures. Irregular or abnormal heart rhythm. Cyclobenzaprine, Flexeril dosage forms and typical dosing. Dosage forms. Cyclobenzaprine is available in different tablet strengths and capsule formulations. The average cost for a 30-tablet supply of 10 mg cyclobenzaprine is around $9 with a GoodRx coupon, which is about 58% lower than the average retail price of $21.44. Tablet dosage options: 5 mg, 30 tablets. Approximately $9.90, about 33 cents per tablet. 7.5 mg, 30 tablets. Approximately $15.90, about 53 cents per tablet. 10 mg, 30 tablets. Approximately $9, about 30 cents per tablet. Typical dosing for cyclobenzaprine. Immediate-release tablets, Flexeril brand and generics for adults and children 15 years and older. The typical starting dose is 5 mg by mouth 3 times daily. If needed, your healthcare provider may increase the dose up to 10 mg 3 times daily, depending on how well your body responds. Extended-release capsules, Amrex brand and generics for adults. The usual starting dose is 15 mg by mouth once daily. If required, the dose may be increased to 30 mg once daily. Cyclobenzaprine is generally prescribed for short-term use, usually up to 2 or 3 weeks. Always follow your provider's instructions carefully and avoid adjusting your dose on your own. Cyclobenzaprine, Flexeril contraindications. Certain health conditions and medical situations make cyclobenzaprine unsafe. You should not take this medication if any of the following apply. Use of a monoamine oxidase inhibitor MAOI within the past 14 days. Recent heart attack. Certain heart conditions such as irregular heartbeat, heart block, or heart failure. Hyperthyroidism. Overactive thyroid. If you have any of these conditions, make sure to tell your healthcare provider before starting cyclobenzaprine. Pharmacist tips for cyclobenzaprine, Flexeril. When taking cyclobenzaprine, Flexeril, following a few pharmacist-recommended tips can help improve effectiveness and reduce side effects. How to take cyclobenzaprine. Cyclobenzaprine can be taken with or without food, but taking it with food may improve absorption and reduce stomach upset. For extended-release capsules, make sure to take your dose at the same time each day to maintain consistent levels in your body. Always swallow the capsule whole. If swallowing is difficult, you can carefully open the capsule and sprinkle the contents on a tablespoon of applesauce. Swallow immediately without chewing. Duration of treatment. Cyclobenzaprine should be used for short-term relief only, typically up to 2 to 3 weeks. There is no evidence supporting long-term use, and other options may be more appropriate for chronic muscle spasms. Managing common side effects. Dry mouth is one of the most frequent side effects. Relief strategies include chewing sugar-free gum, sucking on ice chips, or using specialized mouthwashes and lozenges available at most pharmacies. Because cyclobenzaprine may cause drowsiness, dizziness, or difficulty concentrating, avoid driving or operating heavy machinery until you know how the medication affects you. Do not consume alcohol while taking cyclobenzaprine, as it can significantly worsen these side effects. Drug interactions to watch for. Cyclobenzaprine can interact with other medications that cause drowsiness, such as opioids, benzodiazepines, and sleep aids. When taken together, these can increase the risk of severe sedation or breathing problems. In addition, cyclobenzaprine may interact with certain antidepressants, which can increase the risk of a rare but dangerous condition called serotonin syndrome. Always inform your healthcare provider of all prescription medications, over-the-counter drugs, and supplements you are taking before starting cyclobenzaprine. Key takeaway. Cyclobenzaprine, Flexeril, can provide effective short-term relief for muscle spasms, but it must be taken safely. Follow your provider's instructions, manage common side effects, and always check for possible interactions with other medications. For more expert, science-backed health information, subscribe to HeInfo, your all-in-one destination for trusted medical guidance.